Something the vast majority of people go their entire lives without understanding is that the instant you step into your 60s, the proteins living inside the lens of your eye start accumulating damage at a rate your body has absolutely no mechanism to undo. And the reason behind that is something I find myself marveling at every time I bring it up in conversation. Those proteins were built exactly once, before you had drawn a single breath, during the earliest stages of your development in the womb. And from that point forward, your body never manufactured them again, leaving them responsible for carrying you through your entire existence, absorbing insult after insult, year after year, decade after decade, slowly deforming, clumping together, and converting what was once a flawlessly transparent optical structure into something murky and scattering. And that conversion is precisely what accounts for the blurry vision you open your eyes to each morning, the glowing coronas that expand around oncoming headlights when you drive at night, the stubborn, filmy layer that no quantity of blinking ever fully dissolves. And by the time most people find themselves sitting in front of me, listening to phrases like age-related changes and progressive deterioration, that protein damage has generally been building in silence for 2, sometimes 3 complete decades without producing a single symptom. What I want to do today is take you through 6 seeds, every one of them available at your neighborhood grocery store this afternoon, each containing specific bioactive compounds that directly feed the very protective system your lens proteins have been deprived of, and I have ordered them from least impactful at the bottom to the single one that outperformed every alternative across every measurement I looked at. And I need to flag something about the 3rd seed on this list before we proceed, because the way the vast majority of people currently eat it means their bodies are capturing almost nothing of nutritional value from it whatsoever. But before we reach the seeds themselves, I need you to grasp the internal mechanics of what is actively occurring inside your eyes, because once that mechanism is clear to you, the reasoning behind why these seeds produce results becomes entirely logical, and the explanation for why your previous attempts may have come up short will suddenly make sense. Here is the anatomical truth that almost nobody outside of ophthalmology ever gets to hear. Your eye lens receives no blood supply, not a diminished blood supply, not a disrupted one, none. It is completely cut off from your circulatory system, which means no oxygen delivery, no repair equipment, no replacement parts, nothing at all. It runs entirely on its own internal biochemistry, from the moment you are born until the moment you die, and the molecule that fuels that biochemistry is called glutathione, a compound present in extraordinarily high concentrations inside a youthful lens. And as long as glutathione stays plentiful, the lens proteins remain structurally sound, properly spaced, and optically clear, allowing light to travel through cleanly and land precisely where it belongs on your retina. But here is what published research has confirmed and what almost no mainstream conversation ever acknowledges. Sometime during your 50s, a physical diffusion barrier starts forming around the nucleus, the innermost core of your lens, and that barrier progressively cuts off the glutathione supply to the exact location where the most visually destructive cataracts begin forming, meaning your lens core starts losing its primary antioxidant defense while you are still completely without symptoms, still reading effortlessly, still driving with total confidence. And once that glutathione shield is weakened, the lens proteins begin unfolding, aggregating, and scattering incoming light rather than focusing it. And when I review a patient's scan showing those early stage changes, I can tell them honestly that yes, this is an aging process, but what I also tell them, and what I believe every person has a right to hear, is that this process, the glutathione depletion, the protein clumping, the oxidative cascade spreading through the lens tissue, is meaningfully shaped by what you eat, by specific antioxidants, by specific fatty acids, by compounds found inside 6 seeds that most people walk directly past in the grocery store without a second glance. Cataract surgery is the single most frequently performed surgical procedure in the world. And researchers have calculated that delaying the onset of clinically significant cataracts by just 10 years could cut its overall incidence in half. And yet the nutritional compounds that support the biology capable of making that delay a reality receive almost no public attention whatsoever. And that gap in information is something I intend to close right now. Seed number 6 is sesame seeds. And before you scroll past, there is one critical detail about them that almost no one ever mentions, and that omission is actively robbing people of a substantial portion of their nutritional benefits. Sesame seeds contain zinc, a mineral your retina depends on to activate the enzymatic defenses that protect your photoreceptors and to transport vitamin A from liver storage into your eye tissue where it is actually needed. They contain copper, they contain vitamin E, genuinely valuable micronutrients for eye health. But here is the problem. Sesame seeds are densely loaded with phytic acid, a compound whose primary job inside your digestive tract is to chelate minerals. It physically grabs onto zinc, copper, and every other beneficial mineral in those seeds before your intestinal wall ever gets an opportunity to absorb them, and the entire bound complex moves straight through your system, meaning you chewed it, you swallowed it, you felt good about it, and a meaningful portion of those minerals never once reached your bloodstream. The solution takes 3 minutes and costs you absolutely nothing. Dry roast them in a skillet over medium heat for roughly 3 minutes until a warm, nutty aroma rises and signals that the heat has done its work. Because that thermal exposure dismantles the phytic acid and frees the minerals it was holding captive, and now your body can actually absorb what you spent money on a small handful of toasted sesame seeds over a salad or eggs, approximately $2 per month. But I want to be straightforward with you. Sesame seeds represent a starting point. They can decelerate your rate of loss. They are not reversing anything. And the seeds further up this list function in an entirely different biological category score. 3 out of 10 seed. Number 5 is pumpkin seeds, and this is the entry that tends to genuinely frustrate people who have been eating them consistently for years, because pumpkin seeds contain 2 compounds that Harvard researchers confirmed deposit themselves in one extraordinarily specific location inside your eye. Not the entire eye, one specific structure, the macula, the dense central zone of your retina, responsible for reading, recognizing faces, driving, everything you look at with direct, intentional focus. The region that degrades first and fastest those 2 compounds are lutein and zeaxanthin, and decades of large-scale longitudinal research have connected higher dietary intake of these carotenoids to significantly reduced risk of macular degeneration progression, and the reason is structural. Your macula is literally yellow because it concentrates lutein and zeaxanthin on purpose. Your visual system is biologically designed to collect and stockpile these compounds, and pumpkin seeds also deliver more zinc per ounce than virtually any other seed you can buy, and here is what should genuinely bother you. If you have been eating pumpkin seeds from a bag, roasted, raw, salted, any preparation, you have been absorbing perhaps half of what they actually contain, because pumpkin seeds carry an even heavier phytic acid load than sesame seeds, and until you chemically neutralize that coating, the lutein, the zeaxanthin, the zinc are bound and bypassed entirely. The preparation is almost insultingly simple. The night before, place your pumpkin seeds in a bowl of water, squeeze half a lemon into it, stir once, and leave it for 8 hours, because the citric acid chemically dismantles the phytic acid barrier overnight, and in the morning you drain them, rinse them, and eat them as they are, or dry them briefly in a low oven score. 4.5 out of 10. Seed number 4 is one I find genuinely frustrating in terms of how little recognition it gets, and that is hemp seeds, because while the nutrition world endlessly debates flaxseed versus chia, hemp seeds are sitting right there on the shelf, accomplishing something no other seed on this list can achieve on its own. Your retina is neural tissue, structurally and functionally identical in its cellular vulnerabilities to your brain tissue, and those cells are acutely sensitive to chronic low-grade inflammation. And when inflammatory activity reaches your retinal layers, cell membranes weaken, signal transmission slows, and visual degradation begins in ways that do not show up on a standard eye chart until the structural damage is already well established. The single most consequential nutritional variable in managing that inflammation is the ratio between omega-6 and omega-3 fatty acids in your diet, and modern Western diets push that ratio somewhere between 15 and 20 to 1 in favor of omega-6. While the research indicates the human body performs optimally closer to a ratio of 3 or 4 to 1, that chronic imbalance sustains a low-level inflammatory environment throughout your entire body, including your ocular tissue. Every single day without pause, hemp seeds carry a naturally occurring omega-6 to omega-3 ratio of approximately 3 to 1, and no other widely available seed comes anywhere close to that physiological target. A large meta-analysis synthesizing 19 randomized controlled trials involving more than 4,000 participants confirmed that correcting this fatty acid imbalance produces measurable reductions in the inflammatory biomarkers driving dry eye disease, the persistent burning, the progressive dryness, the gritty foreign body sensation that intensifies as the afternoon stretches on. Score 7.5 out of 10. Seed number 3 is the one I flagged at the very beginning, and that is chia seeds. Specifically, the mechanism by which nearly everyone currently consuming them is extracting almost nothing of value. Let me give you the biology first. Your retina is not partially built from DHA. It is structurally assembled from it. DHA constitutes a major architectural component of the tissue your vision physically depends on. And when DHA is chronically undersupplied, that tissue begins to deteriorate. Cell membranes thin. The structural integrity of your retinal layers erodes quietly over the course of years. Chia seeds are among the most concentrated plant-based sources of ALA, the botanical precursor omega-3 that your body enzymatically converts into DHA, and a large meta-analysis of 19 randomized trials confirmed that omega-3 intake produces measurable improvements in tear film breakup time, which is the clinical measurement of how rapidly your ocular surface dries out between blinks, and when that number is low, every blink feels unfinished. That is the burning, that is the grittiness, that is the relentless sensation of something stuck in your eye that never completely resolves. And here is where the waste happens for millions of people. If you consume chia seeds whole, sprinkled into smoothies, stirred into oatmeal, soaked into a gel, the outer shell of the seed actively resists your digestive enzymes, and those seeds pass through your gastrointestinal tract largely structurally intact, and you absorb a fraction of what you consumed. You are essentially eating the packaging, not the contents. You must grind them 10 seconds in a coffee grinder, and it must be fresh, never from a pre-ground commercial bag, because the instant a chia seed is cracked open and its interior is exposed to oxygen, those omega-3 fatty acids begin oxidizing immediately, and a pre-ground bag that has been sitting in warehouse inventory and then on a retail shelf may have forfeited the majority of its biological potency before you ever unsealed it. Grind them yourself that morning, immediately before eating, and always pair them with a fat source in the same meal, because DHA is fat-soluble, and without dietary fat present at the same time, intestinal absorption drops substantially. A tablespoon of coconut oil blended into a smoothie, a drizzle of olive oil, half a ripe avocado, any quality fat, same meal, same moment, freshly ground with fat immediately within 1 to 2 weeks. Most people notice that the morning dryness is measurably less severe. The day no longer grinds against their eyes by mid-afternoon. And while the structural retinal benefit requires 60 to 90 days to accumulate meaningfully, the surface relief can arrive within the first week. Score 8 out of 10. Seed number 2 surprised me more than any other entry when I went systematically through the research, and that is freshly ground flaxseed paired with avocado. Flaxseed contains more alpha-linolenic acid per gram than any other plant source in existence, more than chia, more than hemp, more than anything else on this list. And 1 tablespoon of freshly ground flax delivers approximately 2,300 milligrams of plant omega-3, while chia delivers roughly 1,700 milligrams for the identical volume. And every single day, that difference compounds biologically. The Women's Health Study, one of the largest and longest nutritional investigations ever conducted, following nearly 40,000 women over multiple years, found that higher dietary omega-3 intake was significantly associated with reduced risk of dry eye syndrome, and flaxseed represents the most concentrated dietary pathway to reaching that intake. The avocado in this pairing is not decoration. Omega-3 fatty acids are fat-soluble, and the monounsaturated oleic acid in avocado has been specifically identified in nutritional bioavailability research as one of the most effective fat carriers for enhancing the intestinal absorption of fat-soluble compounds. That avocado is not accompanying the flaxseed, it is activating it 2 rules, both absolute. Rule 1, grind it fresh that morning, not the night before, not from a pre-ground commercial product. Whole flax seeds in a coffee grinder for 10 seconds immediately before eating. Rule 2, consume it within 15 minutes of grinding because the oxidation clock starts the instant the seed is cracked. 2 tablespoons on half a ripe avocado every morning. The only reason this sits at number 2 rather than number 1 is that the top seed accomplishes something flaxseed biochemically cannot. It delivers an antioxidant that your body actively regenerates inside your lens tissue for hours following a single serving score. 9 out of 10, and the number 1 seed, the one that led every single category I examined, is raw, unsalted sunflower seeds consumed together with a quarter of a ripe avocado and fresh lemon juice squeezed directly over the combination, all 3 elements together. Every morning, sunflower seeds carry more vitamin E per ounce than nearly any food available in a standard grocery store. And 1 ounce, a modest handful, delivers close to half your daily recommended intake of alpha-tocopherol, the specific isoform of vitamin E that your body preferentially absorbs and puts to work, and vitamin E is not performing generalized antioxidant activity in your eye. It is targeted with a precision I want you to fully appreciate. It positions itself within the membranes of your lens fiber cells, the exact cells housing the proteins that were synthesized before your birth and can never under any circumstances be replaced. And from that position inside the membrane, it intercepts oxidative damage before it ever reaches those proteins. A meta-analysis published in Public Health Nutrition, pooling data across multiple cohort studies and clinical trials, found that dietary vitamin E intake was significantly associated with reduced risk of age-related cataracts, with the protective effect being strongest specifically in the lens nucleus, the deepest core, where oxidative damage accumulates over the longest timeframes now, the avocado. Vitamin E is fat-soluble, and without dietary fat present at the moment of consumption, a substantial portion moves through your system before absorption becomes possible, and the monounsaturated oleic acid in avocado is the optimal delivery vehicle for precisely this compound. But the lemon is the element that elevates this combination above everything else on this list, and I want the mechanism to be completely transparent. When a vitamin E molecule neutralizes a free radical inside your lens tissue, which is its entire biological purpose, it becomes oxidized in the process, spent, inactivated. Normally finished vitamin C interrupts that terminal outcome entirely. Research examining the biochemical interaction between vitamin C and vitamin E has confirmed that vitamin C takes that oxidized, spent vitamin E molecule and chemically restores it to its active functional state. It regenerates it, so your single morning serving of vitamin E continues working inside your lens tissue for hours rather than minutes. 1 dose cycling and recycling itself continuously, and you are not simply supplying an antioxidant. You are constructing a self-sustaining protective system. That is why this combination sits unambiguously above everything else I have reviewed. And it costs less than 85 cents per serving. Your precise protocol: 1 ounce of raw, unsalted shelled sunflower seeds, a quarter of a ripe avocado, the juice of half a fresh lemon squeezed directly over everything, all 3 consumed together, same meal, same time, every single morning. And the ingredient label on your sunflower seeds should contain exactly 1 item. If there is anything else listed, put it back on the shelf. Here is what consistent daily use actually produces over time. In the first 3 days, the heavy, gritty, fatigued sensation your eyes carry into the evening, the feeling you have very likely begun accepting as simply what eyes feel like after a full day, begins to ease in a noticeable way by the end of the first week. Morning blur softens, and the fogginess upon waking clears more rapidly by the 2 to 3 week mark. Reading fine print, navigating a phone screen, scanning a menu in a dim restaurant all demand less effort and less squinting by 90 days. The halos around nighttime headlights begin calming, contrast sensitivity improves, and colors carry a vibrancy that has been missing for years. And some patients return from their follow-up appointments and tell me that Dr. Laura noted their numbers did not progress the way the trajectory had indicated. 90 days is the structural window. Dry eye relief arrives faster, sometimes within the first week, but the deeper lens level work requires time. One caution I must be fully explicit about. Sunflower seeds carry a relatively significant omega-6 load, and the dose is 1 ounce per day. That is the therapeutic quantity. Not 2 ounces, not a full cup, 1 ounce, because more is not better, and in this particular case, more actively works against you. Score 10 out of 10 here is your complete daily protocol. Every single morning without exception, your foundation layer, 1 ounce raw, unsalted sunflower seeds, quarter avocado, half a lemon squeezed over everything. Together, non-negotiable same morning. Your omega, 3-layer 2 tablespoons of hemp seeds stirred into yogurt or blended into a smoothie, or 2 tablespoons of freshly ground chia seeds with a fat source present. Hemp if you want zero preparation, ground chia if you want greater omega-3 concentration. Choose one and stay consistent 3 to 4 mornings per week. Your deep structural layer, 2 tablespoons of freshly ground flaxseed on the remaining half of that avocado, ground fresh, consumed within 15 minutes once weekly. Your macular maintenance layer, pumpkin seeds, soaked the night before in water and lemon juice, drained in the morning, a small handful over yogurt or a salad. 3 mistakes that systematically undo all of this work. Mistake 1, coffee or tea within 90 minutes of consuming your seeds, because tannins bind zinc and other minerals and physically obstruct the absorption of what you just carefully prepared coffee after. Always after. Mistake 2, eating these in the evening rather than the morning, because fat-soluble compound absorption is measurably superior within the morning metabolic window. Mistake 3, stopping after 2 weeks because the transformation has not been dramatic enough, because dry eye symptoms respond within days to weeks, while structural lens protection is a 60 to 90 day biological process, and the research on vitamin E and cataract risk was tracked across 18 months of consistent intake. Stopping at 2 weeks is the equivalent of planting a tree, returning 3 days later, and concluding that trees simply do not grow. Do not discontinue any prescribed medications without first consulting Dr. Laura or your own physician, because these seeds support your underlying biology. They are not a substitute for your medical care. Here is what I want you to do before you close this video. Write down the 3 vision complaints that bother you most right now, the specific ones. Rate each from 0 to 10. Put that paper somewhere you will find it in 30 days. And tomorrow morning, start with the sunflower seeds, the avocado, and the lemon. Just that to begin. 1 ounce, a quarter avocado, half a lemon every morning. And if you want to move through this process alongside other people, drop day 1 in the comments right now, 2 words. And come back in 30 days to share what has shifted. Your vision did not decline in a week, and it will not rebuild in a week. But the proteins inside your lens are waiting for the raw materials that carry documented capacity to slow this process down. The grocery store stocks everything on this list. It costs less than $1 per day, and there is genuinely no reason to wait until tomorrow morning.